We're at the Old Town Recovery Center, a brand new gorgeous building. You may have seen it on the corner of Burnside and Broadway. So glad you're with us on Comcast Newsmakers. I'm Ken Ackerman. We are in the lobby of what I told you was this beautiful building. So what goes on here? Well, please welcome Kathleen Roy. She's the Director of Mental Health Services here. Kathleen, thanks for being with us.
Thanks for having me.
So what does go on in this building?
Well, we provide integrated addiction and mental health services to adults that have severe and persistent symptoms of mental illness.
Now, how many would you be able to provide services for here?
We have about 650 to 700 clients enrolled. They're all from Multnomah County. We probably have about 3,000 visits a month.
So this LEED Gold certified building was designed specifically for the purpose of helping people with mental health symptoms.
Correct. And I would love to show you more about that if you would follow me.
We're going to the atrium?
We're going to the atrium.
Okay.
All right.
So Kathleen, prior to this facility, you said you were at a location that wasn't conducive to dealing with the mentally ill.
No, it wasn't. We were at a location on 12th and Stark that had previously been a probation and parole office, and it was the hallways were narrow. It was dark. I mean, we certainly made it work, but when we assumed services of that at that location, we were given a year, and then we needed to find a new home. And we were able to purchase this property.
I see these beautiful turtles here. Now, did they come from the old property?
They came here a week before we did to make sure everything was okay.
Gotcha. And they seem to like it.
They love it here. And as you can see by all this natural light, one of the things that we really want to have the experience is that folks come here and they feel like they are safe, that's a calm environment, that we treat them respectfully.
They come into this room, they sit, they wait for their appointment. It's a beautiful place to be. But you also have a room in this building that's more of a community room. Can we see, what is that called?
Yes, we call that our living room, and I will take you there now.
All right, let's take a look. This is beautiful. What kind of activities would you provide in this living room?
Well, as you can see by the space, we have a kitchen and we have couches and we have sitting areas where folks can just sit and get to know each other, connect, learn about healing and recovery. We do groups, we do art activities, but this is really a place where we want folks to know that they're safe, that they're cared for, and they can learn how to connect with each other differently, so when they're out there in the world, they have a better experience.
And there are more comprehensive health services that go on in this building, right?
Yes, sir. We have integrated health care upstairs. That's part of the Old Town Clinic, and I'm going to be introducing you to Rachel Solotaroff.
Kathleen, thank you very much for joining us.
Thank you, Ken. All righty.
Okay. We're joining now Rachel Solotaroff, who's the Medical Director of Central City Concern. How are you?
I'm good. Good to see you.
Good to see you. Now, in this section of the building, what would you be responsible for?
Well, we provide primary care services, which includes basic medical screenings, health prevention, treating chronic diseases like diabetes and hypertension. But for this population in particular, what we really want to focus on is the promotion of their health and making sure people have the skills to take care of themselves.
Now, what is a team room? You were telling me about that.
So we're organized into teams to try to serve our patients the best. I can show you one right now.
Let's take a look. In there. Yeah.
So one of the most important things for our patients is to coordinate their care, to get everybody who's contributing to a patient's care to sit in a room and be able to talk to each other. You'd be amazed how fractured the system is. This is our way of bringing everyone together. So in this room we have a panel manager who's out today, but she serves as the hub of the team. She is a health assistant. All the primary care doctors sit in here. We also have a psychiatric nurse practitioner who can help with some of the mental health disorders people may have. If those get more severe, then we'll start working with Kathleen's folks to provide that care for them.
Now, you said something that really stood out. You don't want to chase disease?
Exactly. Much of our medical system is focused on just treating an organ system and not treating a whole person. So we want to promote health and not just focus on those diseases of those organs.
And you're going to show me a room now where you do just that?
Exactly.
Okay, let's take a look. So Rachel, this is the movement room?
It is, it is. It's a terrific feature of the new building that we're really excited about. A lot of our patients, as you know, are homeless, are low income, and we may tell them you got to exercise, but they don't have the resources to do that. And so we built this room to give them a space to be able to do yoga, do exercise, even just relax and reflect.
All right, Rachel, thank you very much, and we want to thank you for being here as well on Comcast Newsmakers. I'm Ken Ackerman. Make it a great day.